working at the NFC as a senior midwifery advisor policy perspective, and my colleague Jackie, who's with me today and being on the stand, she has the education background. So usually you see both of us to report both within the NFC but also externally. And what I'd like to take you through is just a reminder of where the standards sort of sit in structure on the education side in the NFC. And what we've done over the last 6 years is to review all the standards for education and training. And you'll see that we've got sort of part 1, part 2, part 3, and then the standards of proficiency for nursing, and also standards of proficiency for midwives, and then standards of proficiency for nursing associates. We are only in England currently. Mary Renfrew mentioned it this morning about the production and the development of standards,
and we were really, really blessed and lucky to have her leading them, because she came with those decades of research experience, the global picture, and also the ability to corral us all into moving forward with what we were saying was, and hearing was, the need for midwifery practice in the 21st century. And at the time, we looked at the context of everything in the UK and also globally. So we were thinking about the 4 countries of the UK, and we were also thinking about the global picture. We were thinking about the underpinning to the standards, and Mary talked about today the Lancet series in midwifery, and also all the evidence base that is there. And we've been blessed again along the way with a lot of evidence-based care coming from originally things like the Cochrane collaboration, and then going into NICE and their pregnancy and childbirth sort of section, and also the underpinnings of the code. And then we've got always the recommendations and findings coming out of reports like Embrace and others. Also guidance from the unions, the professional bodies like the RCM, and other institutions that are UK-wide, like the Council of Deans of Health and so on, that link into the universities. So, putting all that together, we're thinking about the existing and the emerging evidence. We're thinking about the changing demographics and population health, because those of us who, have kept an eye on Call the Midwife, and then are also watching One Born Every Minute and all those, there's no doubt that midwifery care and practice has changed. I mean, back in my sort of student midwife days, and again, it was mentioned today, that there was the sort of, everybody had an episiotomy, and I still have my student midwife book where I had to get my 40 deliveries and all that sort of stuff. And I look at it now, and I'm sort of ashamed of the fact that every woman I looked after had an episiotomy, even though the birth was perfectly straightforward. And that's a change in practice. And we all know, I was lucky, I was the generation that just missed having to do shaves and enemas on everybody. And that was a classic example of the research almost changing practice overnight, and a good example of where there wasn't really a sort of research and effectiveness in practice gap, because it just sort of happened, because I think we'd all hated doing it anyway, and also extremely unpopular with the women, which of course is the key point. And we took into account the lessons from key reports and surveys, and also, as I said, the national policies from the 4 countries. So in the end, what we were saying was that the standards reflect what the public can expect midwives to know and to be able to do in order to deliver safe, effective, respectful, kind, compassionate, person-centred midwifery care. And that's right in the front and up at the beginning of the standards. And the underpinnings were twofold. We had the code, but we also had the framework for quality maternal and newborn health from the Lancet series. And you'll have seen this again in the presentation this morning. And the area that midwifery is responsible for is really everything there except for the sort of obstetric little square at the top right. But all of the rest of it underpins our standards and is implicit to the work that we do every day on a daily basis wherever we're working. And I would say, again, if you haven't read the series itself, this and the the implications and the ethos behind it is knitted right the way through the standards. And you can see where the sort of universal care and where additional care starts to come in from this base. And what we ended up with were standards for midwives and also for student midwives. They were published, 2 of them in 2018, and then the Standards of Proficiency for Midwives, the pale purple, was published in 2019. They were launched in 2020, and every AEI, so every university that teaches midwifery, is now using these standards as the base for their curriculum and the programme. And you'll see that I've also added in the standards for student supervision and assessment. What we've done recently is twofold. We've made some changes to the programme standards after consultation across the UK, and that will be published in the new year if we get the agreement from Council to publish. And we did a consultation and amended and so on. And those changes were updating the language really, because a lot of our language in the programme standards dated back to the European Union and the EU directive. So we wanted to sort of update the language a bit and make it contemporary. So you'll see some changes along that line. And also the other thing that is implicit in the standards for student supervision and assessment is the fact that every midwife is expected to play a part in the education of students when they're in practice. So everybody's involved in the sort of the supervision and the teaching and learning, and also others who are on a register. So it's also about learning from contemporaries, learning from other professions, and that's where the sort of interdisciplinary work comes in as well. And what we ended up with, that you'll be very familiar with, are these interrelated domains, and there are 6 of them. So what we're thinking of is where the domains come in, and we put them in a circle because what we didn't want is for any of them to be sort of taken in a hierarchy. They're all very important, and they all sort of join and feed and interlink and so on. So you've got being an accountable, autonomous professional midwife, you've got safe and effective midwifery care, and that's promoting and providing continuity of care and carer, and that links back to the what we heard this morning about the interventions that actually really make a positive difference, and this is one of them. The other points are around universal care for all women and their newborn infants, additional care for women and infants with complications, and those can be across the spectrum from medical to social to mental health, etc. And then promoting excellence, the midwife as colleague, scholar and leader. And that was an interesting one when we were at the developmental stages, because we had a thought leadership group that brought together students, midwives, researchers, people from other disciplines, educationalists, all into the one room to work out what was needed for the midwife of the future. And this was something that, generally speaking, hadn't been part of necessarily the students' sort of work area or learning area. It had come in from where it had previously been in post-registration learning and education, but it's absolutely in there up front and centre, because you are in a leadership position within midwifery from the word go as a student and then forward into practice. And then in Domain 6, we've pulled together all the sort of skills and from all the other domains, and that's pulling together as the midwife, as the skilled practitioner. And at the beginning, I think there's sometimes a tendency with the standards to think, I'll just sort of dive straight into the standards, but it is worth reading the foreword and the introduction. And there's also a section which is on page 5, I think, in the online version, of 17 interrelated themes. And given that it's coming up to Christmas, the analogy that I would use is that it's like the sort of the reindeer in the Christmas jumper. It's knitted through, the whole of the standards. These 17 themes are like a golden thread. They go right the way through. You'll find them in Domain 1 to Domain 6. And it's, things like evidence-based care, the importance of staying up to date, enabling and advocating for needs, views, preferences and decisions, continuity of care and carer. And the important ones in the context of today are working across the whole continuum of care. It's about that universal care, but also being the lead coordinator whenever you're going into the world of additional care needs. So, and additional care needs is where you're going into, in particular, that interdisciplinary and multi-agency working. There's also a very good section on the role of the midwife in the 21st century, and it's about this emphasis on midwives being ideally placed to anticipate and recognise changes that may lead to complications and additional care needs. And as has been said, this can range from physical, psychological, social, cultural, spiritual, and include perinatal loss and end-of-life care. And again, that was a change that came in because that was sometimes felt that that wasn't really for students, that this should be something that you only sort of went into. But unfortunately, and it has always been, perinatal loss and end-of-life care in that sense around loss in the perinatal space have been part of the midwife's story from the beginning. So it is something that's absolutely appropriate for, the education programme and so on for students. And then again, thinking about the interdisciplinary and multi-agency side of things. And that can vary from colleagues within the unit, but also when you're out in community or in the primary care sort of world, thinking about home births and so on, you're interacting with a whole range of other professionals, and it can be anything from the ambulance service, and many of the ambulance services now, for example, have practice development midwives, or they have consultant midwives actually in the ambulance service, and they're a vital sort of link for when you're thinking about guidelines and so on, and crossing professional, thinking about professional sharing of information and good practice and so on. And I have to say that personally, we're looking at the minute at the midwives' exemptions. And what we're doing is we're linking in with the midwives and ambulance services to get the feedback about what's carried and what they need and what they expect of the midwives if they go into home birth and so on and so forth. So that's a very positive sort of interaction, and also thinking about what you can learn from the other colleagues that you're working with on a daily basis and what they can, of course, learn from you. And it's not about just handing over care. It's about thinking about the midwife's role in this multidisciplinary team space. It's about specific responsibilities for continuity and coordination of care, and that's linking back to the Domain 2 around continuity of care, and then Domain 4 about additional care needs. So even if you're in the sort of space where you're needing help, you're still there to be the sort of continuity thread for the woman and for her care throughout the continuum of her pregnancy. And what I've picked out are just a few of these sort of points in Domains 2 and 4, where we're mentioning interdisciplinary and multi-agency teams and the additional care needs, working in collaboration, and again, demonstrating the knowledge and understanding of how to work together. And the joint aim is to provide respectful, kind, compassionate care, whether it's in the context of everyday care or in the context of end-of-life care and so on. And then in Domain 5, we're going into the knowledge and skills and the expectations around working with women, working with partners. It's not just working in collaboration with colleagues, it's working with advocacy groups. And that's where the multi-agency comes in, because you're thinking about advocacy groups, you're thinking about colleagues, you're thinking about families, you're thinking about women. And we're in a relationship-based profession. Everything we do is about that relationship and building that relationship and the trust and the enthusiasm and kindness and compassion that go with that. And then it's about the range of interdisciplinary learning opportunities. And there's something about the respect that's engendered by working together, ideally from the beginning. so in this sort of student space. And one example of that I've come across is that in Queen's University Belfast, the students actually teach the medical students. So the midwifery students go in and teach the medical students. So that's an interesting approach. And they do that when they're sort of in their second and third years, as far as I remember. And it's, let's just say it was a wee bit challenging at the beginning, and I couldn't work out who was more worried, and the midwifery tutors, the midwifery educationists were absolutely convinced that this was going to be fantastic and it was going to work. And the midwifery students, I have to say, were a bit sort of, not quite convinced about this, but it actually worked really, really well. And then, of course, several years down the line, you're working with those medical students in the different context of practice, but it's about establishing those links. And also, you'll find yourselves in some universities using the same sort of simulation labs and so on to practice your clinical skills and your emergencies and so on and so forth. So that's something that's a positive thing to take into practice. And there's probably a lot more to learn around how you can work collectively and collaboratively in practice and not just at the times when you're doing prompt training, because that development of mutual respect sort of goes through the whole working day. And one of the best things about prompt is the fact that everybody's learning from people who are maybe not what you would have expected in my educational days, when the obstetric emergencies were always taught to you by an obstetrician. So, and nowadays, of course, everybody's in there taking their place as part of the team and working in that learning and teaching space. So it's quite a lot of this is about the leadership education with students, but then thinking about it going forward. There's something about the NMC, the regulator. Names may change along somebody's career. I think I've been under two or three iterations so far, but the regulator and the setting of standards stays with you throughout your midwifery career. So it's something about the standard setting at the beginning, the underpinnings of professional standards and behaviour that comes through in the code, and then in practice with revalidation and also with the teaching that comes in with the standards of supervision. There's a knowledge now expected from people in practice of the standards, because you will be working with students who've had their curriculum based on them, their programme, and you'll also be teaching with the expectation that you're familiar with the contents of the standards. And when you're coming up to either appraisals or revalidation, again, thinking about the standards from the point of view of, is there anything that I need to sort of think about, or was there something in the standards that I didn't really know about? Because if I was looking at these standards, thinking back to when I was a practicing midwife, I would have been thinking, I probably need to do something about strength-based approaches, because I'm not quite sure what that means. So it's about looking at the standards of proficiency and thinking, how can they help me when I'm thinking about what my CPD needs are sort of going forward. So this is going into the skills section in Domain 6 is about this ability to consult, collaborate, refer, and there's particularly for those working in sort of community arenas, there's a whole network out there and it's quite intricate. So it's about learning who to go to and also who to refer to and go back to in the trust or board arena should you need to. And then it's about thinking about those sources of the sort of support you may need, whether it's from medical teams, from obstetric teams, neonatal mental health, social care, or other services. And you're going to be the sort of thread of continuity for the midwife, for the woman, and hopefully the midwife that can sort of act as a source of knowledge and information about the woman and her particular circumstances as she goes through whatever information gathering is needed from the other professionals that you've consulted with. So, distilling that all down, what we're thinking about at the end of the standards was that what you're aiming for are midwives that are skilled, knowledgeable, respectful, kind, compassionate, recognise their own strengths, and they also recognise the strengths of others. There's leadership, there's positive role modelling, and that's really, really important, because we've all worked with folk where they sort of drain the positivity out of a room, and you work with other people where you think, happy days, I'm on with so-and-so, doesn't matter what happens, you know. And I've had one boss in particular, completely unflappable. I could have told her that there was a tsunami heading for the delivery suite, and she'd have been like, fine, we'll sort it, it'll be fine. And those sorts of people, we can all make a decision to go to work and be positive. And I think it's an absolute skill, and you'll know, all of you will know, and I can see smiles around the room where you're thinking of, yeah, absolutely. There's somebody where you think, oh dear, bless us, I'm going to have to like hide tonight and stay out of her way, or, oh, fantastic, this is great, I'm going to really enjoy today's work. And you would like to think that you would be the one, when people see you coming to work, that they'll think, happy days, this is great, we can all, and it's about that working together collaboratively, so that, yes, we'll never have a time where nothing happens or there aren't tricky things that come in, but it's about having the confidence in the team and the people that you work with, that you'll be able to address it together, and that you will get the support that you need to help and to work with women and come get the positive best experience that you can, whatever the circumstances are as you're sort of going forward. So the human factors is something that has sort of come to the fore over the last sort of 10 to 15 years, and it's a really important part of the learning around leadership and thinking about teams and the constituents of teams and how you develop them and all those sorts of things. Strength-based approaches again, and it's about this working with others, play to your strengths, work with others, use the best evidence, whether that's using best evidence for care, whether it's using best evidence for quality improvement or change management. And what I'm thinking of when I'm thinking of using best evidence is that you also use best evidence when you're doing policy making and when you're thinking about standards. And that's where that whole piece of work around thought leadership group, pulling together the evidence. And what Mary was able to do was to use her research team to pull together the best worldwide evidence that we had at the time to inform the standards, so that we knew that what we were putting in the standards was absolutely underlined by the best available evidence at the time. And it's also about, in the leadership section, about teaching people the skills to have the debates and the sort of balanced chats when there isn't particularly good evidence one way or the other. And it's about knowing how to negotiate, how to do those sorts of difficult conversations, particularly, in, as I say, in the cases where there maybe isn't particularly good evidence. And again, that could be something that takes you into the world of research. And many people will tell you that what's triggered their interest in research is when something niggled at them and they just thought, I actually want to know about this. They've looked for it and they found that the information wasn't there. So that can be a trigger. And then it's also about this reflection. And nowadays, everybody's thinking about reflection, and you're thinking about reflection in the context of revalidation and so on. And again, I would like to say that I'm the sort of person that when revalidation is coming up, as soon as I've done it, I start with a new set of paperwork. But I know that many people leave it till they get the reminders from the NMC. If you can, what I would suggest is, for example, after today, this is something that you can count as your CPD. And if you've got the paperwork that the NMC has online, you can start filling it in now, so it's not a sort of like mad sort of at the sort of last couple of months before your revalidation's due. And like I say, I'm not exactly a shining example of this myself, but I can see that the benefits are there for those of us who are doing revalidation. And every time I revalidate, I think I must actually not do it this way the next time. I must actually do it as I go along, which would be much more sensible. But I'd just like to take you through a couple of things that we're doing at the NMC, just to link back to both the standards themselves, but also the ongoing sort of consideration of embedding the standards and implementing them across the UK. Because we all know that it takes a while for changes in standards to get across, particularly into practice. And everybody, as we all know, has been extremely busy, working extremely hard, doing a fantastic job, sort of keeping the show on the road during the last couple of years and going forward. But we've got a couple of things sort of there when you're working with students or when you're thinking about your own CPD and so on. We've got action, little animations that are linked to the code and pull out various aspects of it. We've got various conferences and talks that we do around the future midwife standards, and we've talked about those today. We've got something relatively new, which is an employer link service. And the employer link service, they're spread all over the UK, and there's one for Scotland, and I'll show you a little map with the names attached and so on. But what they're doing is they're linking in with directors of nursing and directors of midwifery, heads of midwifery, to sort of keep people up to date with what's happening with the NMC, but also to come in and do workshops and so on, if that would be helpful. And they're also working with the GMC to do multi-professional workshops on things like professional behaviours and patient safety and so on and so forth. So those sorts of workshops are one aspect of their work, and then Jackie and I work with them to do what are sometimes badged as Midwifery Matters workshops, where we talk through everything from sort of FTP and also thinking about scenarios where the NMC standards can be helpful at starting a conversation, and we go through that in a sort of workshop format. So if anybody's interested in that sort of thing, that is something that we would be delighted to come out and talk to people about. And we tailor it to whatever the board or trust's requirements are and what they would like to hear. We're improving our data sharing, and we often refer to the fact that the NMC has this huge data lake, because we have all the information from registration, we have information from all sorts of sources, but we don't necessarily, I think, make best use of it. So there's been a lot of work going on over the last couple of years to improve the data sharing, and we're sharing with organisations like the GMC, like CQC, like the regulators in the other parts of the UK, just to make sure that everybody's sort of on the same page about, for example, the numbers of registrants, where they're coming from, what's happening, where they're ending up, all those sorts of things. And it's a very sort of useful and positive way of using all the data that we collect. We've done joint duty of candour guidance with the GMC, and that's around the professional duty of candour. So again, the principles cross all our professions. And as I said, we do work with the ELS, which is the Employer Link Service, which is sort of like the outreach branch in a way of the NMC, with the GMC on things like professional behaviours and patient safety. And then they have this regular meeting up with trusts and boards. And there's also something about experiencing different leadership and team working. And the good thing that we've been able to do with the update to the programme standards is that we're hoping to make that sort of much more visible in the programme standards, so that students will experience different types of leadership and sort of working methods in their student experience, because sometimes it's hard to know whether what you're experiencing is what you should be experiencing, or are there better ways or different ways of doing it. So that's something to keep an eye out when the updated programme standards are published. And we will be doing sort of, I suppose, series of workshops and launches of those sort of revamped standards whenever they come out, hopefully in the early new year. And this is what I was talking about the little video clips and so on that are available on the NMC website. This is one of them, which is what to expect of from your midwives. And that's a very positive one, which somewhat unsubtly mentions the standards of proficiency. And you'll see a little animated midwife holding the code and walking around with it. But it's just this was a closing the loop, because we had got a lot of input from women when we were developing the standards. And this was a sort of opportunity for us to say at the end of it, these are the standards that we've ended up with, and this is what you can expect for a midwife, collating all the input that we had, because we had a lot of responses to the consultation, and they were all extremely helpful, and you could see a marked difference between the consultation standards and then the published standards, because we went through every line of every response that we got. The little animations that I mentioned that are connected to the code, they're all, again, badged under the code in action, and they're available on the website. Very useful for anybody working with students or thinking about their sessions on the code, for example. So a little just point to ponder, which is really where these sorts of talks at our conferences come in, and also our implementation work and meeting with people as we are either doing it online or now more face-to-face, talking about the standards and the implementation, which is how do we know that every midwife is adopting the standards of proficiency in their practice. And because I think we badged them as the future midwife standards when they first came out, there was a little bit of a thought process that meant that people thought, well, okay, that's for students. That'll work for their programs, but it doesn't apply necessarily to me as a midwife in practice. But I would emphasise that they're the standards of proficiency for midwives. So while they underpin the student's journey, they're also for use of those midwives in practice. And again, as I said, it's about thinking about knowing them inside out, back to front and sideways, hopefully, if you're supervising students, and also thinking of them in that context for your own CPD development and also for revalidation. A little bit more of what we've planned going forward is that we're, as our work plan, but over a period of years, we'll be thinking about revalidation and the opportunity to update that and review it. And then, as I said, thinking about not just midwives in practice, but also how do we sort of quality assure the midwifery programs, in the sense of, are we achieving what we wanted to achieve with the standards and the programs? And we're doing little mini campaigns, hopefully in the next year, around leadership, listening to women, and holistic care. And that links back to my point about the work that we do is all about relationships and developing them, whether it's with colleagues, but more importantly, it's always with women and their families and so on. And then further work on the standards of supervision and assessment of students. And we're doing an animation that we've been talking to some of you at the table about, that we're going to have sort of little videos really, which will pick up on what the NMC is and does, that are tailored to suit first-year students, second-year students and third-year students, because we're slightly perturbed by some students feeding back that they're very scared of losing their PIN before they've even got it. So we'd like to, in a way, try and address the fear factor that sometimes comes with the mention of the regulator, and hopefully these will help. And we're doing this in the sense of an introduction to the NMC, and as I say, the regulator in some form or other will be with midwives throughout their career, and it can be a positive and supportive relationship rather than a fearful one. And then we're also looking at further work on preceptorship, because we consider that that's really important, that sort of consolidation and confidence building that should happen when you get on the register at first and you're going into, for example, your first job as a registered midwife. I talked about the regulation advisors across the UK, and I'd just like to point out that, for example, in Scotland, the regulation advisor is Linda Martin, Northern Ireland has 2 part-time regulation advisors, and they don't all come from a nursing or midwifery or health visiting background, but many of them do. Some of them come from their former lawyers or their former policemen or something like that. So they're a mixture of professions, but they all are linking in with the directors of nursing, and we've got it backed up with work around employers and managing and so on. So there's a lot of background information that's also available through the RAs, but also on our website. And it's all to do with the refreshed look at fitness to practice always comes from the perspective of thinking about context, but also thinking that nobody gets out of the bed in the morning and thinks, I'll go to work and do a bad job. Everybody wants to do their best when they go to work. So it's about coming at things from that point of view. And we now have senior experienced midwives who look at any cases, for example, that come into FTP. So they're giving clinical advice at the beginning, which is actually, this doesn't need to be an NMC thing. This needs to go back to the trust or back to the board or back to the hospital. This isn't something that needs NMC level investigation. So there's changes afoot. And one of the things is the outreach service that you can now get through the employer liaison service. Now, Jackie's at the edge there and waving. So I've given both our email details, and do feel free to contact us, because it's the sort of, if we don't know, we know a man who can or a woman who can, and we'll direct things around the NMC as we need to.